we do talk a lot about the lack of resources. Cynthia mentioned the lack of beds, treatment centers and hospitals. You both are in the field, you're working in this space, you both offer services. Can you talk a little bit about some of the services that are available? Juan Pablo, would you like to start?
Yeah, it's unfortunate that we are not able to provide services for everybody that will come and ask for what they need. Like our waiting list will be over 100 people, adults, teenagers, etc. And sometimes they need to wait 2 or 3 months to be seen. And we're trying the best we can, but we don't have enough therapists, and we are over 30 people, therapists working here,
Yeah.
So definitely it's a big concern. Our waiting list for assessments are sometimes ridiculous, like 8 months or something like that. So definitely we are very concerned. We would like to have hire more psychologists offering assessments to people, but so we need to refer them to our places because there is no way we can help them, but we are trying to do the best we can, offering just treatment for people with anxiety, depression.
You bet.
They are facing just different life transitions. They're divorcing or they're moving or things like that, or people with just mental illnesses.
Yep.
Etc.
Cynthia, you represent Irely Ball, a community mental health center, really taking care of, the fabric of the community from a mental health standpoint. You came alongside a big health system a few years ago. Can you talk a little bit about some of the work that you're doing and the resources that that are available?
Sure. As both Juan Pablo and Andrew talked about, yep, there is a shortage of therapists. We used to always talk about there's a shortage of psychiatrists, and we still have, there's still a need for medical professionals in mental health, but there's really a need for therapists. And I think anybody who's seeking treatment has noticed that. But I also, so anybody in the field, we're struggling with that. We're all trying to hire just from this tiny little pool of therapists. But there's also some resources that are available to us. And if people need immediate access, I saw someone from the Broadlawn Psych Urgent Care is on this call, and that's fantastic because there are two in the Des Moines area, there are 2 psych behavioral health urgent cares, and that people can walk in and get an immediate assessment, and they can see a med provider, they can see a therapist, they can see case managers who offer support services. So those are fairly new in the whole continuum of behavioral health services. And so if people need that immediate help, they can walk in and get that every day. So that's a wonderful place to start. Also, there are other crisis services that are available. That's a requirement throughout every region in the state. So you can call 988. That's a new number. That's national. It's a 988. It's a national number. Anybody can call it and they can get referred to a crisis service. And these mobile crisis teams will come out to people's homes, do an assessment, get them referred to wherever they need to go. They can maybe get them into a hospital immediately if that's the case, or they can get them referred to appropriate services. So it's not all doom and gloom. There are resources that are available to you when you need them immediately. All community mental health centers, it's a requirement that they can walk into a community mental health center and be seen. And also, I have a statistic somewhere that talks about some people who don't have insurance don't think that they can go and get services, and you can. Every community mental health center, and everybody has them throughout the state, you can walk into a community mental health center and get served regardless of ability to pay. So there are resources available to people. So don't ever let payment or fear of I'm not going to be able to get it anyway, because there are resources out there for people.
Yeah, that's a
Yeah, I
great
would like
place.
to add something, Andrew, if you
Go ahead,
allow
Juan
me
Pablo.
in this section. The Iowa House, recently approved House File 2456, which could, among the other things, expand mental health services by creating 6 access centers, which would benefit individuals experiencing a mental health crisis, but who don't require hospitalization. It would also call for community-based treatment services, such as assertive community treatment teams to help people with severe mental illness avoid hospitalization. So this is something that is coming, and it's good to see that there's more hope there.
Yeah, I
So
think
I
about,
have a
go ahead,
question.
Susanna.
Yeah, I have a question for both Cynthia and Juan Pablo. So if you have somebody in your life who really is in crisis and you're hearing all these things about lack of resources, what I'm hearing you say, Cynthia, is you can just present at some of these places and they will steer you in the right direction. How would that work? Let's talk a little bit for our viewers so that they can understand where to go and what the process might be like.
For sure. Well, because I'm in Des Moines, I'm going to speak to Des Moines, and you can walk into Unity Point Psych Urgent Care. It's located by Lutheran Hospital, and then also Broadlawns has a Psych Urgent Care as well. You can walk in, get services. Again, you can see a med provider, you can see a therapist, you can see a support staff, a support services person that can help you maybe with getting Medicaid or housing, or you can walk in and get services. Again, you can call mobile crisis. Then you can get and meet someone to respond to you in your home immediately. There's also a really, I didn't mention this earlier, but a really neat program is called Crisis Stabilization Community Based. And that's another crisis service where if you're called out on a mobile crisis call and that team doesn't think that you really need hospitalization, but could use more intensive services, they can refer to Crisis Stabilization Community Based, and that will get them a therapist, a med provider, and then someone actually going out to their home and talking with them for an intensive services for a week or even longer. So that's a really, really neat program. When it started, I was like, man, do we really need another crisis service? Love that service. And it has great outcomes because people who really need it can get it immediately and get lots of services at one time. Does that help?
Really helpful. Yeah, that's really helpful.
We
I think
are,
also,
go ahead,
sorry.
Juan Pablo.
No, just I want to mention that here at the Mind Spirit Counseling Center, we have the philosophy of helping people, that don't have the resources, that will come and will use and scale. We will, even if they can pay anything, that is not a barrier to be seen. And we will offer the same quality of service like anybody else that will be able to pay or will have a great insurance. So it's just our philosophy, and we try to be very faithful to that.
Yeah, I think about two things really. From onset to a mental health condition to first dose of treatment, oftentimes is upwards of 7 years, right? So you've got people who aren't reaching out for help because they've heard the help doesn't exist, or they're worried about a complicated system. And I hear both of you indicating that the resources are available. It's so important to make that first phone call. 988 is an easy number to call. I have called it not just to test it, but I've called it because I had someone in crisis and I was interested in where they would direct them for services. You've got Clive Behavioral Health, a major investment in this community recently. And the state, I think oftentimes I hear lobbyists say, don't ask for money. The state's got money, guys, and it continues to invest in projects that are important based on what citizens are asking for. And so I just continue to encourage everyone on this call and people that are listening to advocate for more services, more mental health and behavioral health services to support the community.